Barriers to care in rural communities, really what we're looking at here is transportation issues. Um, there's a lack of public transportation for individuals who live in rural communities. And if they don't have access to a vehicle, then they don't have access to a lot. And in those areas, so long distances to care, it's not like they can walk anywhere. Having a vehicle is really instrumental in getting from point A to point B in rural communities. And long distances to care can mean, you know, uh, my doctor's office is, 10 miles away to it being in a neighboring city and you having to drive 2 hours. It could mean two different things. Even if it is in your community, it doesn't necessarily mean it's close. Whereas, in urban cities, you can get in your car and you can be somewhere you need to be in 2 minutes. Stigma is obviously huge in rural communities. Dr. Kilwine alluded to that as well. Stigma can present from the provider as well as, in self-stigma and from the community. And stigma is extremely prevalent in rural communities. There's a lot of stigma, a lot of fear associated with getting seen at doctor's office, whether it be for addictions or for HIV or whatever the case may be. And in addition to that, provider discrimination, active discrimination against an individual for their HIV or AIDS diagnosis, as well as addiction diagnosis. I know a lot of individuals who struggle with addiction don't receive healthcare for a really long time because of provider discrimination and how they are treated whenever they are seen. More barriers to care in rural communities, confidentiality concerns that kind of goes hand in hand with stigma. In rural communities, it's not uncommon for your mom to work at a doctor's office. It's not uncommon for your second cousin or your best friend's sister or, insert whatever relation to you here at any office there. So confidentiality can be a huge concern, and especially in small towns. Lack of healthcare options, again, there's limited availability of trained professionals, especially in HIV care, as well as rehabs. I know that a lot of rehabs can be really, really far away from rural communities, and you really have to go into a major city or a suburban area to get into a rehab. In addition to when I say lack of qualified professionals, that could go into addictions professionals, it could go into physicians, it could go into mental health providers. Altogether, there's just a lack of options. And I often think of here in Pennsylvania, to me, in Indiana, the closest mental health like inpatient psych hospital is 2 hours away. And to even have an inpatient psych stay, you need to go 2 hours away. Overburdened agencies. So obviously, whenever there's a lack of healthcare options, those ones that do exist are going to be overburdened, and wait times can get into mental health as well as addiction services or anything of the sort can be months out. And really getting someone quick access to care can be a struggle at times. More barriers, delayed information and education to rural communities, which goes in hand to delayed prevention efforts. For rural communities, it takes a while for them to adopt certain practices and get their hands on certain information that is pertinent to any sort of epidemic or pandemic or anything like that. Even funding options can be a really difficult barrier to overcome as far as services go. And also the far off concept, and Dr. Kilwine had made a really good point about this to me the other day, um, about the COVID-19 pandemic, and how, especially in rural communities, even in rural PA, thinking I don't have to worry about this yet because it didn't come to me yet. And really thinking about, um, you know, just thinking that it's gonna, you don't have to act right away. Or even that, well, I might not come into as many contact with people as I would, um, if, like, as I would in an urban area.